I'm a narrative therapist, which one of the main concepts of narrative therapy itself is the problem is the problem, the person is not the problem. And what that basically just means is that if somebody comes in and says, I'm a bad person, the therapist can look at that and say, maybe you're not a bad person, maybe you're a person dealing with a bad situation. So, in a very simplistic way, that's the concept. But for a person to actually separate maybe their anxiety or their depression from their primary identification, okay, that I am an anxious person or I am a depressed person, this is just what my life is, my life sucks and this is how it's going to be forever, because that can never change. If we can change the narrative around that to be, I'm a person with depression, so I'm a person who is dealing with some symptoms of depression, then we are kind of separating that from the identity and the core belief of that person, and then working with it as actually a separate thing from the person, and removing the label of somebody criminalizing their own self for behaving a certain way in their life. Having said that, removing the problem for the person, it doesn't mean that, okay, now it's not my problem and it's just something that's impacting me. But that narrative therapy actually brings back the responsibility to the person, in the sense that, I as a therapist will still empower the person to, based on their strengths and other identifications in their life, that maybe I'm a strong person too, maybe I'm this kind of person, that kind of person, work with it in a way that is still my responsibility. I still can change it. I still have the power to change it. But even if I can't, or even if I can't at this moment, I'm not the horrible person. This problem is the thing that I need to be dealing with.